All right, everyone. So MCCQE1 exam, it is one of the requirements that you need for your Canadian residency or to enter practice through PRA pathways. Everyone who wants to practice medicine in Canada have to go through MCCQE1. It's for both Canadian medical graduates and IMGs. Even physicians who are specialists and come to Canada, most provinces require MCCQE1 plus grade so that they can start practicing in their own specialization or specialty. Um, what the exam is, it's Canada's qualifying exam to make sure those who get medical license, they are assessed based on their knowledge, clinical decision making, which would be expected from someone who graduates medical school. The exam is based on criteria that's referenced in the MCC's website, the objectives, and it's organized under CanMeds, which is an organization associated with the MCC. MCCQE1, it's required for licentiate or licensure of Medical Council of Canada, LMCC. Those who have passed MCCQE1 past January 2026, they can take LMCC without having to get a full license. This just means that you're a registered physician in Canada. Now, coming to why IMGs or why it matters to IMGs, MCCQE1, this is a requirement for practice ready assessment, which is a pathway for people who have completed 2-3 years of residency or who have independent practice from their home country. And for CAMS application, it is for IMGs who have finished medical school and want to continue to enter residency in Canada. The exam is marked pass or fail, but your score, let's say you got 450, it is going to be shared with the programs that you're applying to. And some programs would consider this score, so it can influence the competitiveness of you getting into some programs. And once again, it is one of the core criteria for eligibility before you can get a provincial license or supervised license. In some provinces, they allow clinical assistants license, but for that, you need MCCQE1 school. Provinces like Manitoba, Alberta, I believe they have clinical assistant roles for which are registered or licensed clinical assistants. IMGs who pass MCCQE1, they can apply for that license and then start working in a hospital setting or in a clinical setting as a clinical assistant. All right. Exam before 2025, exam had 2 sections. One was MCQs and the second part was CDM or clinical decision making, which contained, I think, 38 questions. Each question would have 4 to 5 parts, and you had to answer all of them. MCQs, you had to pass both the sections separately or get a passing grade in both sections to be able to pass the exam. If you passed MCQ but failed CDM, it would be considered a failing grade and you won't pass. Now they have removed the CDM part in 2025. April 2025 was the first MCCQE1 exam, which had no CDM. It only had MCQs. But remember, MCC states that the exam has not become easier. It is as challenging as it was in CDM. Those who have taken the exam after April 2025, they would have noticed that most of the clinical decision-making items were included in the MCQs. So you were answering on what next step would be or what would you do in that situation for each patient. The total exam right now is 230 questions, and it's done in 2 sections. Section 1 and Section 2 or Section A and B, however you want to name it. Each section has 115 questions, and you have about 2 hours and 40 minutes for each section, or 160 minutes in total for one section. So once you're done with Section 1, you have the option to take a 45 minutes break, or you can continue if you're confident that you're not tired and you're able to focus. Just continue and finish the exam. There is no rule on when you can finish and give the exam out, or when you can stop taking the exam. Whenever you feel like you're done with the exam, you can just stop right there, take your break, come back for the next section, get it done, and then get done with the exam. They don't require you to sit for a specific amount of time. You can finish in 1 hour if you're quick, or you can take your whole 2 hours, 40 minutes for each section. All right. Now, the exam score, it is not in percentages. So the exam is scored from 300 to 600 scale. And the mean or the midpoint of the scoring is around 150. That's where most students score. And each standard deviation is of 30. So passing grade is 439. If you get 469, it means that you are one standard deviation above the passing grade, which is a good score. Previously, they used 100 to 400. Pass score was 226. It's not used anymore. So we would focus on the 300 to 600 now. Your passing score is 339. Remember, 439. And most students score around 450, which is the mean. Now, the content on the exam, they are not by specialty or by discipline. You will get a question from surgery. Next question would be in medicine. It's not in one specialty or in one discipline, and then the next, and then the next questions are mixed. So you will explore each patient like you are working in a clinic and seeing patients. Each MCQs is kind of similar to what a patient would look like, or how your workday would be in a daily basis as a physician. The questions, they move from symptoms to diagnosis and management. This is the basic structure of most questions. Some questions would ask you about diagnosis, some would ask you management, some would ask you the complications. Anything that MCCQE1 MCC wants to ask, they can ask. You can even think of the pathophysiology that's going to be asked in some questions. The exam has two things: dimensions of care and physician activities. Physician activities such as management, safety, etc., and dimensions of care, how you take care of patient. These are two of the dimensions. You can go and see a full breakdown of what each means in MCC's own website. Some of the high-yield content, especially in the recent few exams: ethics and law, public health and screening, and psychiatry. Exams in the recent few years, the past few, since 2025, they have been heavy on ethics and public health and screening, along with psychiatry. Some students even say that OBGYN has been heavily included in the exam. But remember, exam is of whole of medicine. Your paper would be different from someone else's. So make sure you cover everything. Do not think like, oh, ethics are the most important thing. I have to cover ethics more and just forget about cardiology or GI. No, they're going to ask you cardiology and GI questions too. So make sure you cover everything. Now, who can take this exam? People who have passed medical school, or those who are in final year students. But the only condition is that your medical school has to be listed in World Directory of Medical School, or WDOMS. If it is listed there, then you can apply for physicians apply account, and then from there you can send your documentation for verifications. Once you start your account, you have to verify your credentials through that physician apply account. And if they are not verified, or they're in the process of verifying, and you want to apply for exam, you're still allowed to apply for the exam, but MCC is going to do a preliminary check before they give you the go or the authorization to take the test, authorization to test or ATT number. They will still do a quick screen and then let you take the exam while awaiting verification. But most people get their documents verified first before they start applying. For MCCQE1, there is no limit on attempts. Some may say 4 attempts, but you can take it multiple times. Most people pass on the first. Some people may not pass on the first. They would pass in the second attempt. programs, they would consider recency of your application or your passing. If you passed in 2022, most programs would be a bit reluctant to give you a chance to interview or select you because they would be worried that you may have forgotten what you studied for the exam or what you were capable of doing at that time. But remember one thing, that if you're taking the exam and you pass it, you cannot redo the exam. So if you're taking the exam, make sure you are well prepared so that you can score good on the exam and you don't have to worry about your score being low and matching you off from residencies. Prepare well for the exam, and once you pass, remember there is no takebacks. You have that score forever. That's your MCCQE1 score. Like OSCE, on the other hand, if you take the exam and you don't like the score, next year you can retake the exam. Now, how many times per year is it offered? It's offered 4 times per year in the spring, summer, fall, winter. And the registration opens 2 to 3 months before each session. Good thing about MCCQE1 is that you can apply year round. And once your application window starts, let's say you started in January 2026, it would be until January 2027. You have to take your exam between this 12 months period since you started your application. If you don't take your exam, you're going to lose your application money or the fees that you submitted. For example, if you say that exam is going to be from April to 13 to 24, August 10 to 21, October 19 to 13, winter window early in the year, etc. So these are some of the windows that can appear. Sometimes exam may be held in March too. So just follow up or keep following the website of MCC. It's going to give you the latest update on when your next window or application window is opening and when you can apply for it and when you can take the exam. Now, to take the MCCQE1, unlike NAC, which is in person only, MCCQE1 can be done in 2 situations. First is prometric test centers, which are all over Canada. Like you can find them, I think 4 or 5 of them in the GTA area in Ontario. There is one in Vancouver. Every city, major city in Canada has a prometric test center. And they operate on first come, first served basis. So if you apply and their exam centers are fully booked, they may not give you a spot. There is a second option to take the exam from your home or from another place where you can be monitored, but it's extremely controlled environment. The conditions are very stiff, and the tiniest of mistake can invalidate your score, and you will have to resubmit your fee and retake the exam. So the better option would be if you can go take it in person at Prometrics test centers, because if you take it at your home or at another place that's not Prometric test centers, you may make some tiny mistake, adjust your clothing or look to your left or right, and that would automatically fail your exam. Yes, Dr. Nika?
Yes, please. I saw a recent publication on MCC that there is no more remote proctoring. Have they brought it back?
I'm unaware of that. So if there is no more, then there's no more. So that means exam is now in person only, but this is the
in person only.
Data that I have for now.
Okay.
Thank you. Once again, the remote had lots of problems. Some students took it, no more Prometric. No, Prometric is still going to take your exam. It's just going to be at the test centers. You cannot do it online from your home now. I believe that's what MCC has decided. All right, let's move on to the next slide. Now, how do you register? First step would be physician's apply account and complete source verification of your credentials. This is preferred to do before you pay the fee and then realize you cannot take the exam for whatever reason. Whenever you see the registration window, apply for it, choose a test center of your choice. The fee would be around 1,500, 1,450, 1,500, depending on if they increase it for next year or not. And Once you register, you will receive admission notice, and you can just go to the exam. They will screen you before you enter the exam center. On exam day, when you show up, they're going to ask you for 2 pieces of government issued ID. If you are a permanent resident in Canada, your driver's license and your, I think, health card should work. But if you're not a permanent resident of Canada, your PR card and driver's license, they should work. They are required 2 photo IDs. If you're not a citizen of Canada or a permanent resident, they require your passport. One of the IDs has to be passport, and then you can use the license as a secondary ID. The exam is going to take you a full day. So if you are taking the exam, make sure you do not plan anything after the exam, because it's like 6 hours of exam. And after the exam, you will be exhausted. It's very unlikely that someone would find an energy to do anything after the exam. It's mentally challenging and mentally exhausting. You would feel it in your brain. Your brain is going to be so foggy after the exam that you would want to just go and lay down and have sleep, even though you may not be able to sleep thinking of the MCQs that you may have answered incorrectly. But again, full day is better to keep your full day off for it. Exam is on weekends usually. Some test centers may take it on weekdays, but it's Saturday, Sunday that you would take the exam, so don't plan anything else on the exam day. For exam, you're not allowed to take anything with you. They're gonna give you a board to write notes on, and the paper, pen and paper. They will provide you board and something to write on top of it. Everything else is going to be stored in a locker room that is outside the testing room. You would be screened before you enter the test room. After you go for your break and come back, they will rescreen you. They have the metal detector, everything. They're gonna make you take your pockets, flip your pockets inside out to make sure there is nothing inside the pockets. Now, once you take the exam, the results, they take weeks to come. Some times they take 4 weeks. For some exams, they take up to 12 weeks. So it depends on when you take the exam. If you take the October exam, your results come in November. But if you take any other exams, they usually take 2 to 3 months to show your results. Once you pass, now you can apply for LMCC eligibility, which is basically a registration with Medical Council of Canada as a doctor. And then you can apply for COMS and residency. For residency, you're going to need some more exams, English language exam and family medicine competency exam and CASPER. These are the other 3 exams that you may need for applications. Once you receive your score, identify your weak areas and work on them, so that if you get called into an interview and they ask you about something in that weakness, so that you know how to respond to them. If it is your first time, use MCC's and CanMed's own framework and their materials. Do not rely on just question banks. Canada-specific content, specifically for ethics, public health screening, and psychiatry. The guidelines in Canada are a bit different than USA. So if you have UWorld, which is basically for USMLE, and you're using that as your main source, you're going to struggle with some parts of ethics and public health. Make sure you also do Q banks that are specifically for Canada. For example, your registration for this course, it gives you access to about 6,000 MCQs that Jala Academy has managed to organize. And these are based on the Canadian guidelines. So you can use these as Canadian reference. And one tip that I used to give everyone, and I'm still going to do that, is build your stamina. 230 MCQs under high pressure, they are a lot. You're going to struggle if you don't practice multiple times. Once you are done with your reviews, once you think you're ready for the exam, for the next 1 or 2 months till you are taking your exam, take 230 MCQs back to back. Make if you're doing U word, they have those 40 MCQ sections. Do six sections of U word or six blocks. And if you're doing another MQ bank, make sure you're doing 230 MCQs back to back so that in exam, your brain does not start to fog, so that you can keep your focus during exam. Most people, they do really well on the first section. And when it comes to the second section, they are mentally fatigued. They cannot keep their focus and concentration, and that's where they lose points. So make sure you're able to do 230 to 250 MCQs back to back without losing focus. And it is going to come only with practice. You have to do timed quizzes so that you can practice again and again and again for MCQs and to avoid brain fatigue during exam. Now, a few things. MCCQE1 now only has MCQs. It doesn't have CDM now. And score is now from 300 to 600. Pass is 439. It is a requirement to residency and to license. And if you were to start preparing, verify credentials, look for registration windows, and prepare around the MCC's objectives for physicians. All right, that's a basic information about MCCQE1. Any questions?